Hey there, and welcome to this explainer. Now, if you're someone who wakes up feeling absolutely exhausted, even after you supposedly got a full night's rest, well, you are in the exact right place today. We're looking at a fascinating and often entirely hidden connection, how a crooked nose, specifically what we call a deviated septum, might actually be the secret culprit behind your poor sleep. Okay, let's dive into this and lay out our roadmap for today. We'll be covering the hidden sleep connection, anatomy of blocked airways, spotting the key differences, when the two combine, and finally treatment and next steps. And don't worry, we will absolutely get to concrete treatments by the end. So, Section 1, the hidden sleep connection. You know, for a lot of chronic snorers, or really anyone who's just constantly tired, sleep is this totally frustrating mystery. You go to bed, you seemingly sleep, but you wake up feeling completely drained. And a lot of patients spend years trying to solve this puzzle, right? Not realizing the answer might literally be right in front of their face. So it brings us to this big central question. Can a deviated septum actually cause sleep apnea? Are you waking up exhausted simply because the inside of your nose is just a little crooked? Well, the answer is no. But it makes it worse. Let's set the record straight and just bust this common myth right out of the gate. Based on our source material, a deviated septum doesn't usually cause sleep apnea all on its own. However, it can make breathing significantly harder, it ramps up your snoring, and it can drastically reduce how comfortable your medical treatments are down the road. Moving right along to Section 2, anatomy of blocked airways. To really get a grip on what's happening while you're sleeping, it actually helps to think of your respiratory system kind of like a plumbing system in a house. A deviated septum happens when that wall of cartilage and bone, the one separating the two sides of your nose, is off-center. So in our whole plumbing analogy, your nose is the main intake valve for oxygen. When that septum is deviated, it's basically a physical kink in your intake valve. It restricts airflow, meaning the air just cannot flow in smoothly. And man, the symptoms of having that blocked intake valve are remarkably frustrating. You might have difficulty breathing through just one nostril, or deal with chronic daytime congestion, frequent mouth breathing, recurring sinus infections, and loud snoring and generally poor sleep. I mean, imagine dealing with that kind of disruption day in and day out. It absolutely affects your entire quality of life. Right, so let's define the other half of this equation, sleep apnea. Now, unlike that fixed physical blockage of bone and cartilage up in your nose, sleep apnea is defined as repeated airway collapse in the throat. Going back to our plumbing terms, this isn't a blocked intake valve at the top. No, this is the actual main pipe itself collapsing, completely shutting off the flow of air while you're fast asleep. That brings us to Section 3, spotting the key differences. Now, what's really interesting about this slide is how doctors actually separate these two distinct issues. Let's contrast those root causes side by side. A deviated septum is a fixed structural blockage inside the nose. It's there whether you're wide awake or asleep. Sleep apnea, on the other hand, is a dynamic issue. It's a repeated airway collapse in the throat that specifically happens during sleep when your muscles relax. Recognizing this physical difference, permanent structure versus temporary collapse, is absolutely crucial to figuring out the right fix. Let's systematically walk through this data together. The main problem, as we said, is nasal structure versus throat collapse. The symptoms are different too. A deviated septum often causes one-sided breathing difficulty and maybe nosebleeds, whereas sleep apnea is notorious for dangerous breathing pauses and extreme daytime fatigue. But take a look at the diagnosis row. This is vital. To diagnose a deviated septum, an ENT specialist will usually do a physical exam, maybe using a tiny lighted nasal endoscope. But for sleep apnea, you need a home sleep test or an overnight sleep study to actually monitor your breathing while you are unconscious. Which leads us to Section 4, when the two combine. Okay, we're moving into a really critical phase here to see exactly what happens when you suffer from both of these conditions at the exact same time. It triggers this wild biological domino effect. Step 1, your nasal passage is blocked by the deviated septum. Step 2, because you can't get enough air through your nose, your body automatically shifts to mouth breathing while you sleep. Step 3, breathing through your mouth all night severely dries out your throat. And Step 4, that dry, unconditioned air causes the airway to vibrate louder and narrow much, much faster. So when your throat muscles naturally relax during sleep, this whole chain reaction makes the airway collapse of sleep apnea happen way more easily. And it just feels so much worse. So the crucial point is captured perfectly in this quote right from our source material. A deviated septum is usually one contributing factor rather than the sole cause of sleep apnea. If your nose is blocked, your body just has to work that much harder to move air. That extra breathing resistance doesn't, invent sleep apnea out of thin air, but it certainly turns up the dial on its severity. It makes restful sleep nearly impossible.
All right, section 5, treatment and next steps.
I know exactly how frustrating this part can be. If you've been prescribed a CPAP machine for sleep apnea, but your nose is structurally blocked, wearing a standard nasal mask can feel like trying to blow air against a solid brick wall. But please, don't give up. Instead, try these practical adjustments. Maybe test out a full-face mask so you can comfortably breathe through your mouth. Use heated humidification to stop that painful throat dryness we just talked about. And definitely work with your doctor to adjust your pressure settings. Your therapy has to be fine-tuned to fit you. You really shouldn't have to suffer just to fit the therapy, right?
And this brilliantly illustrates our next option. A septoplasty is a surgical procedure that literally straightens out the septum so air can move more freely. But here is the critical takeaway. While a septoplasty can vastly improve your breathing, and hey, it makes wearing a CPAP mask incredibly tolerable, it is rarely a standalone cure for sleep apnea. Remember our plumbing analogy? It fixes the intake valve at the top, for sure, but it doesn't automatically stop the pipe in your throat from collapsing.
Which brings us to this really surprising and honestly highly helpful fact. A home sleep test can detect sleep apnea even if you have a deviated septum. The test is measuring your overall breathing patterns and the drops in your oxygen levels over the course of the whole night, completely regardless of that nasal blockage. So, options like the home testing from providers such as cpapRX are highly effective, super accessible starting points to figure out exactly what your body is doing at night. So, when is it actually time to see a doctor? Well, if you check any of these boxes, if you snore loudly, wake up tired, breathe mostly through your mouth, or feel congested most nights, it's time to act. I strongly urge you to seek a combined evaluation from an ENT or a sleep specialist. Because when you tackle both the structural blockage in your nose and the collapse in your throat at the same time, that combined approach gets life-changing results. I'll leave you with this provocative thought to chew on. Are you just treating the snoring, or is it time to finally uncover the real blockage? Don't settle for another night of poor, exhausting sleep. Take that next step to get a comprehensive diagnosis and finally give your body the rest it actually deserves. Thank you so much for joining me for this explainer, and sleep well.